Okay, so antidepressant medication, main four classes. We're gonna take a look at the selective serotonin reuptake inhibitors in this video. One of the safest class of drugs for depression, widely used nowadays because of low side effects, good safety margin. All right, let's take a look about the mechanism of action. So this medication prevents the reuptake of serotonin into the presynaptic nerve terminal, and when it prevents the reuptake, that means it makes serotonin more available in the brain. And one of the proposed theory for the depression, the cause of depression, is low serotonin level. Now, when this medication prevents the reuptake and make the serotonin available for more time, it will increase the level of serotonin in the brain and will eventually relieve the symptoms of depression. They have a low side effect since only this is like specifically for serotonin. Like if you have watched the videos for tricyclic antidepressant and monoamine oxidase inhibitors, for example, tricyclic works on norepinephrine and serotonin both. Monoamine works on several of them, like norepinephrine, epinephrine, serotonin, and dopamine. So they have more side effects because it increases the level of more than one neurotransmitter while we require only serotonin. So they will cause more side effects, while this one specifically works on serotonin, increasing the level of serotonin. This one have a low side effects and a high safety margin, and they are the preferred medication for depression and other mood disorder. Like when I say other mood disorders, would be like there are some disorders like obsessive compulsive disorders, like those. Sometimes they use this medication for bipolar, because in bipolar there are two phases of bipolar: maniac, like if you know about the bipolar, is maniac phase, and depression. Now, in depression, they will use this medication for that. However, the most often used medication for bipolar is lithium. We already talked about, but they may use this antidepressant medication in bipolar as well. So, if someone has a like only obsessive problems, like repetitive thoughts, like that, to stabilize the mood, they may use these medications as well. So they're used for more than one mood disorders, not only for the depression. That's what I meant to say. Their side effects, the main side effects is the sexual dysfunction, nausea, headache, weight gain, and anxiety and insomnias are the other side effects that you don't see it often. The sexual dysfunction is the main one. There's other side effects is called the serotonin syndrome. It can happen, like as we talked in previous videos of MAOI, monoamine oxidase inhibitors, and tricyclic antidepressant, that if you take these drugs at the same time, it can cause really bad side effects. When you stop one medication, and any class of medication in antidepressant, you have to wait for 2 to 3 weeks before you start another class of medication. However, sometimes if they do start within 2 to 3 weeks, it can cause the serotonin syndrome, and basically it causes the hypertension, confusion, anxiety, tremors, ataxia, hyperpraxia, and sweating. So that's the one you need to really look for. So whenever you change medication for these patients for depression, wait at least 2 to 3 weeks. Otherwise, it'll cause severe side effects. The examples for this medication is citalopram, paroxetine, sertraline, and fluoxetine. Now, here's another thing to remember for this medication is, for any kind of antidepressant, if they are on this medication, they are more prone, they have more suicidal tendency. So even if they are on MAOI, MAOIs, which is monoamine oxidase inhibitors, tricyclic antidepressants, or this SSRI, which is selective serotonin reuptake inhibitors. They are more prone for suicidal tendency. So if you have a patient just was recently started on this medication, you have to put them on suicide precautions. So that's another thing to remember about these medications as well. Hope you like this and learned about this antidepressant medication very well. If you have any questions about this medication, feel free to ask us. Thanks for watching.